The House will come to order.
Got a calendar for me? Which one are we doing? Okay, I can't find it on here. Health and Human. One second. I need a title. Yeah, well, I need something. Yeah, am I yesterday's? Thank you.
I think so.
Yep.
Representative Winkler.
Madam Speaker, I move that House File 2414 be taken from the table for further consideration.
Representative Winkler moves that House File 2414 be brought from the table. All those in favor say aye. Aye. Any opposed, nay. The motion prevails. And the bill is before us. Report from the Committee on Rules and Legislative Administration.
Winkler from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designate the following bills to be placed on the calendar for the day for Monday, April 29th, 2019, and establish the pre-filing requirement for amendments offered to the following bills. Senate File Number 802 and 2415.
The clerk will report the bill.
House File Number 2414, an act relating to Health and Human Services budget, the first engrossment.
There are amendments at the desk. If there's no objection, we will let the author explain the bill before we take up the amendments. Representative Liebling.
Madam Speaker and members, health. If you have it, you take it for granted. If you don't have it, nothing affects you more. House File 2414 is a great bill. It's a bill that will touch every Minnesotan. It will make health care more accessible and affordable, and it will give Minnesotans a better opportunity to be healthy and productive. Before I turn this over to other members who are going to talk about the bill in a bit more detail, I just want to acknowledge that this bill was put together by a fantastic team. Not only are there many, many members on both sides of the aisle who have provisions in this bill, but the staff who have worked on this bill, both partisan and nonpartisan, have been absolutely tremendous. This bill is truly a team effort, and I thank everyone who's worked so hard. And with that, Madam Speaker, I'm going to sit down and allow other members who also have worked on the bill, and by the way, not everyone, because we'd be here for a very long time, but I'm going to allow other members to give more detail about what this bill does that makes it such a very special bill. Thank you.
I call on Representative Mann.
Thank you, Madam Speaker. Members, this bill was crafted very intentionally with provisions like the OneCare dental benefit, the licensing and the requiring transparency from the pharmacy benefit managers, covering asthma prevention measures, and utilizing the state's bulk buying power to lower the cost of drugs. We are working towards lowering the cost of health care. Along with lowering the cost of drugs and investing in prevention, which is cheaper than treatment, this bill will also take the steps necessary to improve the overall access to health care as we expand appropriate level care and beds, including mental health treatment. Some of the problems that this bill is trying to address includes the lack of dental care in Minnesota. I work in the ER and I take care of patients on a very regular basis and on most of my shifts that have dental pain or dental problems, and that's not the way it should be. We are going to address the cost of asthma treatment in this state because these things are things that we can prevent. This bill will address the ever-increasing cost of prescription drugs, which of course leads to one of the biggest healthcare issues that we have, and that is that people are dying because they cannot get their treatment. Because of provisions from Representatives Howard, Morrison, Lesh, Bonner, Cantrell, and others, we are going to hold Big Pharma accountable, and we are going to require that they explain the unaffordable costs of these drugs and to help change their trajectory. This bill will also address the organizations that are gaming the system, making bigger and bigger profits while charging patients more and more money for the same product. And most importantly, this bill is patient-centered. It is not about those who siphon money out of our healthcare system for the profits and make profits when you get sick. This bill is about lowering the cost to the patient and getting healthcare to the patient. For the first time in a long time, we are going to take care of people and not profits. And that is what this bill does. Thank you.
Representative Schultz.
Thank you, Madam Speaker and members. Every page in this Health and Human Services Omnibus bill is important and vital to the people of Minnesota. And that's because the bill improves access to health care for our people living in the state, from the very young to our most senior Minnesotans. It also improves the quality of health care provided to our most vulnerable. Specifically, this bill addresses the problems of elder abuse in assisted living facilities, low wages for those providing care to our most vulnerable citizens, and improvements in sustainability and financing of long-term care. Over the past 2 years, we've heard tragic stories from families about the maltreatment of loved ones in assisted living facilities. This bill includes language that the Republican-controlled legislature failed to enact last session. The bill protects our loved ones in assisted living facilities by creating licensure that exists in all states except Minnesota. It protects against retaliation and deceptive marketing, gives residents rights, and provides additional funding for our long-term care ombudsman's office. It also provides opportunities for electronic monitoring. The bill will help prevent elder abuse and improve the quality of long-term care in Minnesota. It provides the assurances that families are demanding, assurances that their loved ones are getting the very best care. To protect vulnerable citizens, the bill includes language that increases reimbursement rates to providers caring for individuals with disabilities. It increases the historically low wages for care providers to address our workforce shortages, includes inflationary increases, improves reporting to ensure rate increases are going to wages, and requires quality inspections. It has the support from the industry and from advocates. In the area of long-term care specifically, we have enhanced our quality metrics being used to provide stronger incentives for nursing homes to improve quality of care being provided. We cap excessive growth in nursing home administrative costs, which have been increasing by more than 25%, and provide reimbursement of costs associated with high wages for healthcare providers and non-clinical staff. We also improve the fairness of our property rate valuations of nursing homes. Finally, for children in our state who are living with disabilities, we reduce the parental contribution fees required for the families of children enrolled in our MA Medical Assistance TEFRA program by 15%. A 15% reduction, which reduces the cost of providing services that our most vulnerable children need. Minnesota is near the top of states in terms of the level of services we provide in our health services public programs. Services for the aged, for children, for individuals with disabilities, and for adults. We should be proud of the services we provide, proud that Minnesota is at the top of most states in providing the highest level of services. We should not be trying to cut our level of services and benefits to be like other states. We do not want to race to the bottom. And that's because we care about the people of Minnesota. We care that they have access to the best possible health care and services, and that's why, members, you should support this bill. Thank you.
Representative Olson.
Thank you, Madam Speaker. This is a really good bill, a really important bill. Just yesterday, I got an email from a healthcare provider in my district just alerting me to the fact as we go into debate today that according to needs assessment in our Northeast region, they pointed to mental health and substance abuse treatment as two of the three greatest unmet needs in our community as it regards to health. So I'm proud of a bill that does a number of positive things to help those across our state who are struggling with mental health and substance abuse. The bill includes $1 million in funding for pilot projects to address the opioid epidemic in the state. These pilot projects aim to increase the number of people who receive opioid use disorder treatment and recovery services, and thus reduce the rising number of opioid overdose deaths related across the state. Additionally, this bill expands the successful model of certified community behavioral health clinics in Minnesota, which provides coordinated care for a substance abuse disorder treatment and mental illness. Minnesota is currently one of the 8 states participating in a federal pilot program to test a new model of community-based mental health and substance use disorder care known as Certified Community Behavioral Health Clinics, CCBHCs. And according to one of the pilot providers in my district, they say that this has already expanded services, increased our staffing, and provided higher quality integrated care for our clients. And in their words, this is a home run. In the first year of the program, over 17,000 children and adults were assisted through this program. The additional funding will add in 5 additional providers becoming CCBHCs within the next biennium. The early results are promising. They're improving the access to care, reducing wait times, improving coordination, expanding the scope of services, and improving their ability to meet individual needs. This bill also expands needed investments in both school-linked mental health programs and children's residential mental health services, something I know that both sides of the aisle care deeply about. The bill also includes reform of how the state is conducting substance use disorder service delivery, which not only has 2 rate increases, but also saves money for the state through additional federal revenue. This section of the bill includes rate increases for participating providers for the substance abuse disorder program, a 15% increase for residential treatment, and a 10% increase for outpatient individual and group treatment. Finally, this section of the bill includes an effort to reform and simplify regulations for state-funded mental health services by aligning basic standards for different services and eliminating requirements that fail to add value or enhance quality. The goal is to help providers better understand the regulations that apply to their services and will be able to design common practices across the service lines for staff training, electronic medical records, and compliance.
Representative Kunesh-Podein.
Thank you, Madam Speaker, and I'm very proud to stand up and address you on this bill because this bill takes aim to reducing the health disparities across our great state. First of all, it includes a long overdue increase in cash assistance available to lower level income children and families through the Minnesota Family Investment Program, otherwise known as MFIP. This is the first increase, members, since 1986. This was an issue that was examined in depth in our division, and I am proud of the bipartisan authors who we had on this bill to make it happen, such as Representatives Hamilton, Pearson, and Baker. 23 years ago, I was one of those recipients of this safety net of MFIB. As a single mom, 3 kids, working full-time during the day, a couple part-time jobs, going to school on the weekend to get my teaching degree, I found myself in a really sticky situation, and Minnesota was there to help me. it was really heartbreaking to know that it's taken this long to get an increase to our families, and I'm proud to be a part of this. The bill also does so much for women's health, including Representative Morrison's bill to fund breast cancer screening and Representative Halverson's bill to increase access to contraceptives. This bill also includes legislation from Representative Becker-Finn to set up a grant program for sexual assault and domestic violence prevention, and this would establish the very first domestic violence prevention grant program with our state dollars, and I think that's an important investment. In the area of mental health, and we've all heard from our constituents the issues around mental health, the bill provides Representative Vang's bill to provide grant funding to culturally competent mental health providers as a one-size-does-fit-all when it comes to dealing with mental health. This bill will also include Representative Hassan's bill to educate diverse communities on the hazards of skin lightening creams. And it also funds Representative Purcell's bill relating to tribal child protection programs at the White Earth Nation and Leech Lake Band of Ojibwe. It sets up initiatives for transition in child protection services at the Red Lake Nation and Mille Lacs Band of Ojibwe. This program will speed up the transition from counties to tribal nations on child welfare issues in this state. And finally, this bill includes my proposal to provide grant funding for child development grants across the state to help lower health disparities for communities of color and American Indian children. I am a proud member to be on this HHS committee, and I ask you all to support this bill. Thank you.
Representative Pinto.
Thank you, Madam Speaker, and I'm glad to follow Representative Kanesh Pudin because the work of the Early Childhood Division really has focused on closing those disparities and framing our work around getting every child off to a great start in life. We really learned about two linked crises. One is the opportunity gap that we see throughout our society, Minnesotans from different racial and ethnic backgrounds, and then also the challenge in childcare access and affordability. Every one of our district's members, parents are struggling to find childcare that they can access and can afford. And these are really linked. That as families are struggling, we've got short-term economic development challenges for companies. We heard about that in the course of our work, and then long-term as well. And so we're really investing in early care, development, and learning. So members, on Tuesday, we heard about the programs in the education bill, and today we're learning about the programs, and we'll be discussing the programs in the Health and Human Services bill. Expanding access to home visiting, a critical bipartisan program, and that proposal authored by Representative Bonner. Supporting providers, the Retain grant program authored by Representative Wozlowick to allow, to support our child care providers to be able to stay in the field. Providing assistance to providers in construction and business planning. Chair Davney actually authored that. And child care assistance, providing federal conformity to make sure that we're conforming with federal requirements. We're increasing rates. Members, it's important to note that providers right now are being paid the 25th percentile of a survey that was taken 8 years ago, increasing those rates and significantly reducing the waiting list of children on the list as well. And finally, ensuring the integrity of the program. I sense we might have a few amendments on that, so I'm going to save some of my details discussing that for a little bit later. But making sure that the program is in place to be serving the kids and families that it's aimed for. And of course, there's so much else as well. Minnesota Family Investment Program, doula care, Community Solutions Fund, all tied around that point of getting children off to a great start for the benefit of all of us. Look forward to the discussion. Thank you, Madam Speaker.
Representative Moran.
Thank you, Madam Speaker, and members. It has been a joy being a part of the Health and Human Service Finance Committee and chairing the Health and Human Service Policy Committee. And as one who believes that government has a role in making people's lives better, I am honored and excited to have played a role in bringing this and having many of the bills go through my committee that we were here today. Within this omnibus bill, there are provisions that will strengthen families and help working families in Minnesota. For the first time again in 33 years, we are increasing the MFIP cash benefits along with the support that DFLers did in the 13-14 legislative session to have housing vouchers for infant families. The cash increase along with that will help families become more secure, less vulnerable, and a little bit more independent around their own self-care and taking care of their families. Within this bill, we look at doulas, and we increase the reimbursement rates for doulas, and we repeal a sunset of a pilot program for Black doulas who are working with Black families to decrease the birth deaths of African American babies. That is huge. Within our child protection system, I know that we all share the values that families belong together. And we all believe that children are to be loved, protected, and nurtured. So within this bill, when parents cannot take care of their children children themselves, we believe that the first priority of removal should be with kinship. So we focus on that. This bill also removes barriers through a licensing process for foster parenting so that we are aligning those foster care licensing provision with the adoption provision for licensing. Our child care assistance program, it plays a vital role in ensuring that children are in a safe, nurturing, loving, and learning environment when parents on MFIP are working, looking for work, in a training program, or going to school. These are all great provisions within this bill. This bill is a bill that supports and strengthens families. It is a good bill that we need to support. And before I sit down, I just want to say that as the chair of Health and Human Service Policy, there is no way that I could have allowed, I think it was like 138 bills come through that committee and really allow a lot of the stories, a lot of the issues that so many people cared about be heard. And that was done on both sides of the aisle. And so I am really, really excited about this bill, and I look forward to your support. Thank you.
Representative Halverson.
Thank you, Madam Speaker. And we know from being out in our communities that far too many Minnesotans are feeling insecure in the healthcare system. We know this because we talk to folks every day who may not even have health care, but they're afraid they're going to lose it. And those who can't afford premiums are extremely vulnerable in the system. And this bill works hard to address those. We want to be sure that the system, the healthcare system, is there for Minnesotans, and that it's promoting both health and care, and that all Minnesotans can have access to health and care in this great state. And so this bill provides a menu of options to deal with the rising costs of health care, starting with a reduction of premiums in the individual market by 20%, a short-term fix for a problem that certainly has long-term implications. And then the bill goes on to ensure that we are going to put adequacy in place throughout Greater Minnesota so that if folks don't have adequate networks, they can buy in to a premium plan and make sure that they can see providers in their district. Affordability is vital, and so is accessibility to health care. If you can't get to your doctor, it's hard to get health care. And so we also take aim at network adequacy and make sure that there are more guardrails in place so that people can access healthcare providers in their district. And people want security in the healthcare system. And that means reining in short-term health plans that have started to grow within the market. These are plans that promise a lot and provide little. They leave Minnesotans vulnerable to lack of payment for any illness or injury. And it's time for us to take aim at those plans and make sure that Minnesotans have access to plans that actually provide coverage and care for their conditions. And speaking of conditions, there's a lot of us who have worked together across the aisle to make sure that people that we come in contact with in our district get coverage for diseases that might not be well known. Diseases that might be seeing a lot of change within the care continuum and best practices quickly because of new research. And Representative Albright, really appreciate Representative Albright's partnership on the PANDAS bill for kids who suffer greatly with regard to reactions to strep, an illness that for a lot of us was a rite of passage as a child, but for thousands of kids in Minnesota, it creates an unbelievable set of circumstances that they need to get care for. We also worked with Representative Poston for one of his constituents, Mr. Nelson. Wanted to give a shout out to the great testimony we heard from Mr. Nelson on ectodermal dysplasia. And we want to be sure that the kids who are diagnosed with this rare disease can get access to the care they need currently. One of the effects of this disease is that they don't develop teeth. And dentures and other dental work are not covered for these kids because it's being called cosmetic. But I don't know about you, I need my teeth. I need my teeth to eat. And we want to be sure that these kids can get the care that they need. And so thank you for the bipartisan work on this. And finally, this bill also takes aim at addressing the sad epidemic of e-cigarette use among youth and the rising use of tobacco products among youth and young adults. And I'm really proud of that work. It's incredibly important work, and I'm so proud that that work has become so bipartisan. So thank you to all of our partners across the aisle in making sure that Minnesota is building the next smoke-free generation. And finally, I want to thank all the chairs in healthcare. The work in this bill has been hard, laborious, but it's been a labor of love, and we can't do this if we're not a team. And both on this side of the aisle and the other side of the aisle, there's some really wonderful work that has gone into this bill, and appreciate everybody's input.
Representative Cantrell.
Thank you, Madam Speaker, members. I have to say it has been an incredible honor to be able to work over the past many months with such an incredible team of people. And I want to thank everybody who served on the Health and Human Services Finance Division and the Health and Human Services Policy Division, the chairs, Chair Moran and Chair Liebling, for their incredible leadership and dedication to working to address what we heard from many of our community members over the past few years especially, and that is uncertainty in regards to whether or not somebody is going to be able to afford their pharmaceuticals or the outrageous cost of health care in Minnesota. Personally, I started running while I was still undergoing chemotherapy in the fall of 2017 for stage 2 Hodgkin's lymphoma. I saw firsthand how out of control the cost of health care is for patients in Minnesota. And I wanted to make sure that everybody is able to call themselves a survivor and not be denied treatment because of financial obstacles to receiving life-saving medications and treatment for treatable illnesses in the state of Minnesota. So it's a real pleasure to have been able to work on so many of these really incredible policies included in this bill. But I wanted to highlight a couple areas that I think are particularly important for us to address right now. A couple years ago, this legislature changed a decades-old policy that only allowed nonprofit health management organizations, HMOs, to sell plans in Minnesota. Now, this had been the policy in our state since 1973, since HMOs were first authorized in Minnesota. But a couple years ago, an unvetted, unstructured change to this policy that is now coming to fruition as the moratorium ends leaves patients in Minnesota wondering, am I going to be treated like a human being? Am I going to be treated like a patient? Or am I going to be treated like a commodity off of whom a profit is to be made? Now, there is research, ample research, dating back to the late 90s that has indicated that the quality of care offered through for-profit health management organizations is significantly lower than that offered through nonprofit HMOs. By that same idea, patient satisfaction is significantly greater with nonprofit HMOs. And for patients who belong to less affluent communities and who are in poorer health, often receive a lower quality of care from health plans and health management organizations that view them only as a mechanism through which to line their corporate bank accounts in their pockets. So in this bill, we reverse that change. We say that no one's health should be used as a mechanism to generate profit. And we restore this decades-old policy in Minnesota of once again requiring health management organizations to be organized as a nonprofit organization in Minnesota. But we also have to look at some troubling trends that we've seen over the past couple years. And that, of course, is the filtration, the transfer of Minnesota healthcare money that patients have paid in to their health plans in the form of premiums, leaving the state of Minnesota to then be used to bolster for-profit branches of certain HMOs that I'm not going to name. But Minnesotans should know that every penny that they pay towards the cost of health care should be going to the cost of health care and should not be going out of state to serve people who aren't Minnesotans, to serve the interests of a for-profit organization. So we have a couple of provisions in this bill that will ensure greater oversight and review of these transfers. And should any of our health management organizations convert to for-profit entities, we are going to make sure that our state government does not leave Minnesota patients behind, and that there is the highest level of oversight in these conversions and these transactions. And finally, we want to make sure that if a patient is paying money for health care coverage through their plan, that their health management organization is spending a significant amount of that money not on overhead costs, not on pay raises, but on the actual cost of care. So members, I'm really excited about this bill that we have worked so hard to put together. I'm excited for the changes that we have included that will positively benefit Minnesotans and work to reduce the cost of health care. And I'm extremely grateful for the opportunity to be here and work with all of you. Thank you.
Representative Loeffler.
Thank you, Madam Speaker and members. The Health Care Access Fund has consistently been improving the lives and health of Minnesotans while reducing health care costs and sustaining our health care workforce for over 26 years. But nothing that has been so built into our basic public infrastructure has so recently been confronted by misunderstandings, myths, and wrong assumptions. Every Minnesota community and its residents, insured or not, has benefited from the Healthcare Access Fund and its investments across our state and every corner of the state. If you don't know how it's reduced healthcare costs, I think it's time you start paying attention. I know the Healthcare Access Fund isn't something that a lot of you work on, but it makes a huge difference in the affordability of healthcare and the sustainability of the hospitals and clinics in your area. When the bipartisan rural and urban group of legislators got together 25 years ago, or 26 years ago, to design this system, they learned, their big focus was how to reduce healthcare costs. Isn't that something we talk about? They discovered that one of the major drivers of healthcare costs was the cost of the uninsured, because people get sick and get injured whether they have insurance or not. And because we have an ethical healthcare workforce and we have laws that say hospitals will treat everyone who is sick, they got care. But when they couldn't pay their bills, or they could only pay a tiny fraction of it, the unpaid cost of their care shifted into higher hospital and clinic charges that in turn raised the premiums on everyone who has insurance. It's directly linked. We are all in the same healthcare economy. Minnesota has consistently rated amongst the most affordable insurance rates in the nation, even though we all still think they're too high, and I agree. And that's not by accident, it's by design, because we have had consistently one of the lowest rates of uninsured in the nation ever since passing this 25 years ago. And that's meant that people's bills get paid for. We stop the cost shifting from the uninsured to the insured, and we're getting people diagnosed earlier, getting them to the clinic instead of the emergency room, and preventing preventable disease and disability. It has also been critical to sustaining our rural healthcare infrastructure and clinics and hospitals. Mary Krinke of the Minnesota Hospital Association testified that this is absolutely needed by our rural hospitals, that we continue the Healthcare Access Fund and the funding that it provides to them. We have 77 critical access rural hospitals. These are the ones in population-sparse areas that we all count to be there if we're in an accident on the way here and there across Minnesota. And they are reimbursed their cost. It's recognized by the federal government as a legitimate cost. And so it costs, the provider tax costs them nothing, but it's what keeps them in the black, because their margins are so small that every unpaid patient puts them at risk. This is the Hospital Association saying that every rural hospital is at risk if we increase the amount of people who do not have insurance coverage, and that is what will happen if we do not sustain the Healthcare Access Fund. It has been a reliable source of providers for all areas, not just the rural areas. We have a healthcare workforce shortage coming at us full steam, just as we have an aging population. The Healthcare Access Fund is what provides loan forgiveness when people go practice in rural areas. It helps recruit new doctors into needed specialties, some of which don't pay as much as some others. It has played a critical role in our healthcare workforce. And so healthcare coverage and affordability isn't enough if you don't have that provider that can see you within a reasonable distance of your home. It's also, and this is most recognized, provided appreciated and sometimes life-saving coverage for many throughout the state. It has enabled farmers to get their health care needs met in the bad years when there's just no income and paying the bills is tough. And we know there's a lot of people in that circumstance right now. It has sustained a lot of people who are small employers or self-employed who could never have done that without the help of publicly subsidized, they still pay premium, Minnesota Care Program. And it has allowed people who were forced into early retirement or chose it to have affordable coverage until they're age 65 and Medicare kicks in. Door knocking, I ran into a person I'd never met before, and he said, do you have anything to do with this Minnesota Care Program? I said, oh yeah, that's a state program, I know a lot about it. He said, I want to tell you it saved my life. He was laid off in his late 50s. He'd found a part-time job, but he couldn't afford health insurance. Something happened. This was there. It saved his life. It's been built into our healthcare economics for over 26 years. A fourth of it comes from our pharmaceutical wholesalers. The rate increases in this bill will more than cover it, and discontinuing it will not reduce healthcare costs across the board. It will not. Instead, we'll return to cost shifting, where the costs will have more uninsured. Their costs will shift onto the prices that everyone else pays. We'll have more people who put off getting early diagnosis tests because they can't afford it, whose disease is caught too late or it's much more expensive. One of your biggest risk factors of mortality is being uninsured. If you're uninsured, your chances of dying are significantly higher. If you get a cancer diagnosis and you're uninsured, your mortality rate goes up 60% just because you probably didn't catch it early, and you may not get the most advanced treatments there because you can't afford it. And we can't have enough spaghetti dinners and GoFundMe accounts to pick up the difference. I'm proud that this bill continues the provider tax. It's supported by continuing the Healthcare Access Fund. It's supported by all our major medical groups. You have a letter that was distributed yesterday on the floor, signed by over 150 organizations, farm organizations, unions, AARP, and all the senior organizations, faith groups of all different types, people from every corner of the state of Minnesota who realize if we don't continue the Healthcare Access Fund, we are going to put at risk our entire healthcare system for 1.2 million Minnesotans. That's how many people are served by medical assistance in Minnesota Care. That includes the elderly, the disabled, as well as those who are working but need a little extra help to afford that health premium. And we will not be able to take that kind of loss, and many of these dollars leverage federal dollars, so the impact is even greater. I'm so proud that we are continuing to step up for the health of our people, to sustain the providers and clinics and the doctors that they need throughout the state, and that it benefits Minnesota across the state.
Representative Liebling.
Thank you, Madam Speaker and members. Well, that was a brief introduction of our bill. I think you can see why so many of us are really proud of the bill and very excited about it, and there is a lot more to say. But in the interest of time, I'm not going to say that now. I'm going to sit down, and we're going to take the amendments. I'm sure we're going to have some discussion. And those of us who serve on Health and Human Services are really excited to finally get to this discussion, and we are really excited about this bill. So thank you very much, Madam Speaker.
Representative Liebling offers the following amendment. The clerk will report the amendment.
Liebling moves to amend House File Number 2414, the first engrossment. The amendment is coded A125.
I recognize the author of the amendment, Representative Liebling, to explain the amendment.
Thank you, Madam Speaker. This is the author's amendment. Every large bill has one. It just really is technical. It just cleans up technical provisions in the bill. There shouldn't be anything controversial here. If members have particular questions, there are different pieces in this that come from different members. So I will leave it at that and ask for your support. Thank you.
Is there any discussion on the A125 amendment? Seeing none, all those in favor say aye. Aye. Any opposed, nay. The motion prevails. The amendment is adopted. Representative Pinto offers the following amendment. The clerk will report the amendment.
Pinto moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A187.
The author of the amendment, Representative Pinto.
Thank you, Madam Speaker. Members, the A187 amendment is a funding shift among a couple programs that impact the youngest and most vulnerable Minnesotans. What it does is it funds, it supports the closure of the disparities in prenatal care experienced by our residents. This is a program that's had bipartisan support, including being included in Chair Matt Dean's bill last year, and the program that the money shifted from is still receiving a 20% increase over the past, and I'd ask for your support of this. Thank you.
So any discussion on the A187 amendment? Seeing none, all those in favor say aye. Aye. Any opposed, nay. The motion prevails. The amendment is adopted. There's another amendment at the desk. Representative Cagle offers the following amendment. The clerk will report the amendment.
Cagle moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A202.
I recognize the author of the amendment, Representative Cagle, to explain the amendment.
Thank you, Madam Speaker. This amendment would simply designate May as Maternal Mental Health Month in order to educate the public, promote and encourage every Minnesotan to understand postpartum mood and anxiety disorders. These disorders are treatable, and addressing them will save lives.
Is there any discussion on the A202 amendment? Representative Liebling.
Thank you, Madam Speaker. This is a great amendment. Please support it.
Seeing no further discussion, all those in favor say aye. Aye. Any opposed, nay. The motion prevails. The amendment is adopted. There's another amendment at the desk. Representative Moran offers the following amendment. The clerk will report the amendment.
Moran moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A205.
I recognize the author of the amendment, Representative Moran, to explain the amendment.
Yes, thank you, Madam Speaker. So this amendment establishes a permanent program for the integrated care. This is also called coordinated or comprehensive care for high-risk pregnancies. The work is aimed at native-born African-American women who are 3 to 4 times as likely to die from pregnancy-related causes as their white counterparts. And the integrated care for high-risk pregnancies pilot program was funded by the Department of Human Services, DHS, through a grant made possible through Minnesota Statute 256B.79. So there's no fiscal impact. Thank you.
Representative Liebling.
Thank you, Madam Speaker. Another great amendment that supports pregnant moms and babies. Please support it.
Any other discussion on the A205 amendment? Representative Pearson.
Madam Speaker, if the author of the House File 2414 would yield for a question.
She will yield. Representative Pearson.
Madam Speaker and Chair Liebling, is there a reason these last two bills weren't included in the omnibus, mega omnibus health care bill?
Representative Liebling.
Thank you, Madam Speaker. This particular bill, as I understand, was initially thought to have a cost, and so it was not included, and Representative Moran could speak to this herself, but she found out that indeed the money is there, and it's just a language change to allow this to continue. So with any bill, there's always things that have to be done, that you keep finding out more things, and this is something she discovered late in the game. So it doesn't change anything fiscally. It's just allowing a very good program to continue.
Representative Pearson.
Thank you, Madam Speaker. And if the chair would continue to yield.
She will. Representative Pearson.
Thank you, Madam Speaker. I guess I asked about both amendments because the A202 certainly doesn't have a fiscal impact. I'm just curious why, again, a good bill like this that's endorsed by the chair was not included in a bill that is currently, I guess as submitted, was over 1,000 pages. I guess I'm curious why that hadn't been included in this over 1,000-page Health and Human Services Omnibus mega bill.
Representative Liebling.
Thank you, Madam Speaker. Well, our committee heard an enormous number of bills this session, and so did the HHS Policy Committee. We have met very aggressive timelines this session. In fact, I don't remember in my now 15 years of service, I do not remember committees working as hard as they have this year. And so naturally, there was so much work to do, including, by the way, work that was left undone from last session that we had to pick up and redo and re-examine. So it's really not that surprising that there were some things, relatively minor things that are important, but that are, don't really add a lot of weight to the bill, but are very important and add a lot to the health of Minnesotans. And so we've tried to accommodate members on those kinds of things.
Any further discussion? Representative Pearson.
I just wanted to thank you for allowing that line of questions, Madam Speaker. And it's funny that she mentions the weight of the bill. I think it tips the scale at 12 pounds. So thank you, Madam Speaker.
Any further discussion on the A205 amendment? Seeing none, all those in favor say aye. Any opposed, nay. The motion prevails. The amendment is adopted. Representative Morrison offers the following amendment. The clerk will report the amendment.
Morrison moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A92.
I recognize the author of the amendment, Representative Morrison, to explain the amendment.
Thank you, Madam Speaker. Members, this amendment is very important to ensure that pregnant women continue prenatal care and that their babies have good health outcomes. Currently, healthcare and social service professionals are mandated to report a pregnant woman to a local welfare agency if she tests positive for any controlled substance other than alcohol or cannabis. Unfortunately, mandatory reporting of controlled substance use after prenatal screenings leads to distrust of providers and avoidance of prenatal care during pregnancy. This amendment eliminates barriers to accessing prenatal care. Pregnant women who have substance use disorders should have access to comprehensive services, including prenatal care, drug treatment, and social support services. These women often do not seek prenatal care until late in pregnancy or not at all, because they are worried that they will be stigmatized or that their newborn will be taken away. Currently, Hennepin County Medical Center alone is seeing 6 to 12 babies born each week addicted to opioids. Targeting women who use drugs during pregnancy for criminal prosecution drives women away from treatment vital for both them and their baby. I can tell you firsthand how important trust is in the doctor-patient relationship. Women with a substance use disorder need health care, not condemnation. For that to occur, women must believe and know that their provider is on their team. The worst possible thing for them and their baby is to avoid prenatal care. This amendment provides a step in that direction. Members, please vote yes.
Any discussion on the A92 amendment? Seeing none, all those in favor say aye. Any opposed, nay. The motion prevails. The amendment is adopted. Representative Scott offers the following amendment. The clerk will report the amendment.
Scott moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded 178-3.
I recognize the author of the amendment, Representative Scott, to explain the amendment.
Thank you, Madam Speaker. Thank you for hearing this amendment this morning. And this amendment, members, addresses the prescription monitoring program. And for those of you that are new and may not know what that is, it's a program where people that are using opioids, their data goes into a database so that and it's entered in by pharmacies and providers, and so that they can, and then providers on site at clinics and so forth, when they're looking to prescribe to somebody, they can look onto this PMP and see if perhaps those people are doctor shopping. It also keeps an eye on how many opioids one prescriber might be prescribing. And so we're addressing some technical things that go along with protecting the data that is on this PMP. And Madam Speaker, I do have an amendment to move to remove one piece of the original amendment. I'd like to offer that now.
Representative Scott offers the following amendment to the amendment. The clerk will report the amendment.
Scott moves to amend her amendment to House File Number 2414, the first engrossment as amended. The amendment to the amendment is coded A202.
Representative Scott to the amendment.
Thank you, Madam Speaker. And so what this amendment does is just remove some various qualifiers that would have complicated this section. And so I would ask for member support on the amendment to the amendment.
So any discussion on the A202 amendment to the amendment? Representative Liebling.
Thank you, Madam Speaker. We would support the amendment to the amendment. Please vote yes.
Any further discussion? All those in favor say aye. Any opposed, nay. Motion prevails. The amendment to the amendment is adopted. Representative Scott.
Thank you, Madam Speaker. So what this bill does is it adds to Representative Liebling's some of her language already in the current bill, and it just broadens it a little bit so that there's some auditing done annually of people that are permissible users. And we're asking for an annual audit, and then we're asking that the results of those audits be provided to members of the legislature in the HHS realm and in the data practices realm. And also, it also sets in law that if a person that is a delegate of a permissible user, if they leave the employment of that permissible user, that the permissible user has to terminate that person's access 3 days after they leave that employment. And with that, members, I would stand for questions and ask for your support of the bill or the amendment.
Are there any discussion to the A178-3 amendment as amended? Representative Liebling.
Thank you, Madam Speaker. First, I would need to correct the record that the amendment to the amendment, I believe, was the A208, not the 202, as was reported. But to the amendment, the underlying amendment, I just want to thank Representative Scott for working on this. This is a very bipartisan issue, one that is a concern of many members in this body, and I appreciate her taking on doing this important work and would ask members to support the amendment as amended.
Any further discussion to the A178-3 amendment as amended? Seeing none, all those in favor say aye. Any opposed, nay. The motion prevails. The amendment A178-3 as amended has been adopted. Representative Schumacher has an amendment. The clerk will report the amendment.
Schumacher moves to amend House File Number 2414, the first engrossment, as amended, and the amendment is coded A122.
The author of the amendment, Representative Schumacher, will explain the amendment.
Thank you, Madam Speaker. Members, the A122 amendment is a pretty simple one. It basically says that if OneCare were to become law, that the office spaces that are put up within the OneCare office couldn't be named after the authors of the bills that presented OneCare in the legislature. We had an issue with this with Minshew a few years ago. It created a little bit of a controversy. Now, I know that Representative Liebling does not find her legacy in building things like this, but just to be sure, because there are well-intentioned staff that sometimes get a little too well-intentioned with some of their things, and so I think that this would be proper for us to push forward, but I also think that just bringing the issue to light, to know that the legislature is watching these future events is enough, and so, Madam Speaker, I will withdraw the amendment.
There is an amendment at the desk. Representative Albright offers the following amendment. The clerk will report the amendment.
Albright moves to amend House File Number 2414, the first engrossment, as amended. The amendment is coded A130.
To the author of the amendment, Representative Albright, to explain the amendment.
Thank you, Madam Speaker. Members, this amendment would set up a hospital deficiency fund, which makes payments to hospitals across the state in order to mitigate the low payments they're going to be forced to take under the OneCare proposal. The fund will be filled with money from a premium tax against the buy-in plans, a tax the buy-in isn't subject to under your bill, but which every other insurance product sold in the state must pay. One report on rural hospitals found that 19 rural hospitals in our state are at risk of closing unless their financial situations improve. Of those 19, 12 are considered essential to their community because of the service they provide. The OneCare proposal will eliminate access to treatment for thousands of Minnesotans if it passes in its current form. Members, let's protect against hospitals being forced to close and set up a fund that will protect them if they need it. And with that, Madam Speaker, I would ask for a roll call on the amendment. Thank you.
Roll call being requested. Seeing 15 hands, there will be a roll call. There is an amendment to the amendment at the desk. The clerk will report the amendment.
Liebling moves to amend the Albright Amendment to House File Number 2414, the first and Grossman as amended. The amendment to the amendment is coded A214.
I will call on the author of the amendment, Representative Liebling.
Thank you, Madam Speaker. Actually, Representative Schultz is going to offer that, so I'm going to let her speak to the amendment.
Representative Schultz.
Thank you, Madam Chair and members. The secondary amendment to A130 basically renames this deficiency fund to the reimbursement fund, and it repurposes the funds to mitigate uncompensated care caused by high deductible plans. So it should help those hospitals that are struggling with high levels of uncompensated care. And if we really do care about our rural hospitals, we should definitely not sunset the provider tax. So members, I urge your support for the secondary amendment.
Is there any further discussion on that amendment? Representative Albright.
Thank you, Madam Speaker. And Representative Schultz, while I certainly appreciate the intention of the amendment to my amendment, the purpose of my amendment is not to reinforce the cost of high deductibles plans, but to provide that efficiency for all plans, not just those where they are uncompensated because of the high deductibility nature of the policy itself. Let's try to treat everyone fairly. Rural hospitals don't make a differentiation in terms of the quality of care for those that either have a high deductible plan or one that has a low copay. I don't think this body or this amendment does service to that. Thank you.
Any further discussion to the amendment to the amendment? Seeing none, Representative Liebling.
Thank you, Madam Speaker. Just to ask members to please support the amendment to the amendment.
All those in favor to the amendment say aye. Aye. Any opposed, nay? No. The motion prevails and the amendment to the amendment is adopted. Back to the underlying amendment. Is there any further discussion? Representative Schultz.
Thank you, Madam Chair. Members, please vote yes on this amendment.
Any further discussion to the A130 amendment as amended? Representative Albright.
Thank you, Madam Speaker. And I just wanted to remind myself I did ask for a roll call.
Yes, you did ask for a roll call.
Thank you, Madam Speaker.
Any further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 122 yeas and 0 nays, the amendment is adopted. There's another amendment at the desk. Representative Schumacher offers the following amendment. The clerk will report the amendment.
Schumacher moves to amend House File Number 2414, the first and Grossman as amended. The amendment is coded A172.
To the author of the amendment, Representative Schumacher, to explain the amendment.
Thank you, Madam Speaker. The A172 amendment would fund the emergency insulin program established in this bill instead of funding the IT project enhancements at the Department of Human Services. There's $23 million already at DHS for IT projects, and this bill suggests that we should put another $10 million into it. We could do a lot of good in this state with $33 million. For example, we could supply free insulin to thousands of Minnesotans, to those who truly need it. That's just one of the countless important ways that we could fund this. We use the $10 million that we are providing in this bill, and it could be better spent on school-linked mental health grants or opioid prevention, just to name a couple of other ideas. I think these bills are meant to show that the priorities of this chamber and what kind of priorities we actually are showing from today. But with that being said, Madam Speaker, I will withdraw this amendment.
Representative Schumacher withdraws the A172 amendment. There's another amendment at the desk. The clerk will report the amendment.
Cantrell moves to amend House File Number 2414, the first engrossment, as amended, and the amendment is coded A19-0464.
The author of the amendment, Representative Cantrell, will speak to the amendment.
Thank you, Madam Speaker, members. My amendment today is an amendment of a bill that a few of you may have heard throughout this session. It was heard in Health and Human Services Policy Division, and it was subsequently heard in the Commerce Committee as well. This bill would ban the roundly discredited and demonstrably harmful practice of anti-gay, anti-LGBT conversion therapy in the state of Minnesota. Now, at the hearings that we had, multiple mental health professionals, medical professionals spoke in favor of this bill, in addition to several clergy and faith leaders as well. This bill is only about making sure that no one is deceived by fraudulent healthcare practices in the state of Minnesota, and that none of our children in our state are subjected to a discredited and unscientific therapy that oftentimes results in lifelong mental illness and suicidal ideation. This is something that we can all get behind, that we can all be proud of, because I think we all agree no therapy should harm our children, and no therapy should be deceptive. And I want to emphasize, in closing, that conversion therapy has been condemned by almost every single major medical organization in the country, including the American Psychological Association, the American Medical Association, and many, many more. So in closing, members, I ask, please, for your support of this amendment, and you will see distributed to you letters of support from mental health and healthcare professional organizations, as well as letters of support for this provision from clergy. So I'd urge your support, members. Thank you so much.
Discussion. Representative Miller.
Thank you, Madam Speaker. I believe I have an amendment to this amendment.
There's an amendment to the amendment. The clerk will report the amendment.
Miller moves to amend the Cantrell amendment to House File Number 2414 as amended. The amendment to the amendment is coded A19-0492.
Representative Miller, to-year amendment.
Thank you, Madam Speaker. And members, we'll certainly get back to further discussion on the Cantrell amendment. And I thank you for your patience here. I know we're kind of going into some more difficult issues, but I think we need to. I wish we didn't have to talk about an issue like this, but I wish we didn't have to talk about this because this sort of thing should be a no-brainer. We shouldn't be doing some certain things in Minnesota as it is. I think this is a no-brainer. Members, this amendment that I have is about the protection of children. I think the issue of sex change surgery and other therapies falls in lines with female genital mutilation, which we've talked about in the last couple of years. It's been a very difficult conversation, but that too was about the protection of children, and yet we had those debates. We had those difficult arguments, and we're still allowing that to occur in our state. I know many of you don't like my amendment. I know many of you would rather not us talk about this, but this is what we do, legislators. Sometimes we have to talk about the difficult things in our state and get through it. Members, there's a big lie that's being propagated in what's happening in the state of Minnesota. That lie, that God made a mistake when he made them, that they have the wrong body. Saying someone was born in the wrong body is just plain false. God does not make mistakes. Now, I understand there can be feelings, there can be thoughts that don't fit with a person's body. Absolutely. You know, members, as a kid, all I wanted to do was play dolls with my daughter, or with my sister, I'm sorry. My nephew, what he wanted for Christmas when he was about 8 years old was patent leather shoes and a patent leather purse. I have a relative of my family right now who is a youth who is considering what gender they are. And I know my example of me playing with dolls is very minor in comparison to some of the much more serious and much more difficult things that parents are facing these days. But I want you to understand that all those different things, whether they're more difficult than that or just simple as me wanting to play with dolls, that's perfectly normal. And I accept that. There are ways that we have to learn about ourselves, our bodies, who we are, how we relate to other people in this world, our relationship to them. We are growing, developing minds. We are growing, developing bodies. Puberty is a tough time for boys, awful for girls. There's lots of questions that we arrive to. And you know what? That's all perfectly normal. But what isn't normal is what I've seen in the state of Minnesota, members, with how parents, or with, pardon me, not with parents, with how adults react to this. We should be teaching our children. We should be loving them. We should be accommodating to them. There's no problem with these different things that people are experiencing. But we must also be encouraging and educating them. We must be reminding them that God did not make a mistake with who they are, and they are perfect just the way that they are. Now, if at such time when they become adults, they decide that they want to do this, that's perfectly fine. If kids want to identify as a different gender as they're growing up, that's perfectly fine. But members, we are talking about the sterilization, the mutilization of the human body. How does a 7-year-old even know if they want to have a baby when they're an adult? Well, if they're 14 and they have surgery, they can no longer have that option. How can they possibly know that they want to identify and live a certain way? There are some studies, and I know we argue a lot about studies on this House floor, different percentages, but I've heard as much as 70% of children who identify as transgender in some way, as adults become their match up with their biology, who they are, a boy or a girl. Even if it's 70%, even if it's 5%, that's a significant percentage. Now, members, there's lots of things that we can do that we can love and encourage, and we can support them in where they are in their lives. But this surgery and these therapies are permanent and they're long-lasting. I think this is common sense. I don't think this is a real negative on them. I take offense. No one has said this in here, but I take offense when they say, "Why do you hate children?" Or I've received some messages that this is a death sentence. I certainly don't want that. Okay, I'm a supporter of children. You'll see my record. I fight for children. I defend them in many different ways, and that's what I'm trying to do here. So members, I ask for your support.
Madam Speaker.
Representative Olson.
Point of order.
State your point of order.
This amendment to the amendment is out of order under 3.21B. It expands the scope of the primary amendment and introduces new subject.
Advice, Representative Miller.
Thank you, Madam Speaker and members. So I know the pattern that goes here when it's called out of order. I appreciate that. I would hope that people would be willing to discuss this, be willing to stand with or vote for where they stand on this, but I understand that's not going to happen, so thank you.
Thank you, Representative Miller. Because of the pre-filing rule, I know these rulings come fast, and maybe it seems that who's ever presiding is not thinking them through, but we have had time to consider the amendments as drafted and pre-filed and consult with nonpartisan staff, and I find the point of order well taken. Discussion to the underlying amendment. Representative Miller.
And I can wait if there was someone else in line. Am I the first one up? Madam Speaker, okay, I'll continue on. Thank you. Okay, members, changing subjects here equally is difficult. Conversion therapy, anti-conversion therapy. Members, I've read this bill. I've spoken with professionals. I spoke with a young woman representing Outfront Minnesota, and this in my office. I've heard what Representative Cantrell has said about this. I've had other people that have called it child abuse. As I said in my previous amendment to the amendment, I'm a defender of children, and this is very serious stuff, so I've investigated what it is. Members, I think it's real important for all of us, if we're going to vote on this, to know what's in the bill. I did not see her, so I'll move to Representative Cantrell. Would Representative Cantrell yield to a couple questions?
He will yield. Representative Miller.
So, Representative Cantrell, do you have in your district any clinics that are currently performing these services?
Representative Cantrell.
Thank you, Madam Speaker. Representative Miller, it's difficult to ascertain with absolute certainty what specialties, which practices provide these services and which practices do not.
Representative Miller.
Thank you, Madam Speaker. Well, Representative Cantrell, you do. And it's called counseling care. And do you know who owns and runs counseling care in your district? Will yield to that question.
He will yield. Representative Cantrell.
Thank you, Madam Speaker. Representative Miller, I'd be pleased to find out.
Representative Miller.
Representative Cantrell, I'm actually a little bit shocked by that, legitimately shocked. Because if you're moving forward with something as serious as this, I would expect you to understand the scope of this. Now, the young woman who came to my office from out front, and I take her at her word, I asked, and I said, where is this being performed, if you will? I asked her a series of questions that I'll give the answers to in a second. I asked her, is this prescriptive, meaning there is like conversion therapy, like it's, the best example I have is like 12 steps or something like that. Is there something like that? And I said, where is this being performed? And she said, quote, taking her at her word, she said 2 places in Minnesota. And I said, where are those 2 places in Minnesota? And she said, they're both owned by Marcus Bachman and they're in the cities. There's 2 of them. One of them, Representative Cantrell, is in your district. The other one is in Representative Christian's district in Lake Elmo. It's called counseling care. Now, this is in your district. Now, since you didn't know who it was or where it was at, I'm going to jump to the conclusion that you didn't talk to Marcus Bachman about this. But because this is a very important bill, this is like nation noticing. This is a very big thing to make this. This is a big deal, and you've admitted to that. So I talked to Dr. Bachman, and here's some of the things that he told me, representatives, and I think this is important. Bills like this, members, I just pause for a second. Bills like this, we kind of have our gut feeling right away. We hear certain words. We react to those words. But I think we need to get down to what things really are. That's why I called him. When this young woman came to my office, I really wanted to know. And I told her, I said, I'm going to find out what this is because I seriously do not want child abuse going on, because that's the words that she used. I do not want child abuse going on. I do not want prescriptive measures that are radical, okay? We want to seriously investigate this. So I called Dr. Bachman and I said, so tell me about this. So here's a couple notes real quick. Number 1, there are no prescriptive measures, meaning there's no program called conversion therapy. It is simply when a child goes to a Christian therapist to address their sexuality. Now, when I say to a Christian therapist, to my knowledge, these are the only therapists that are doing this. Again, it's only 2 in Minnesota. Both are Christian, so I'm going to sue that. Number 2, therapy, as with all therapy in family therapy, but he does punctuate it here, therapy is client-directed, meaning it is always focused on the interests of the client, not an agenda by someone else. By the way, this bill removes the ability for that person to go in and say, doctor, I want help, just so you're aware of that. So they even lose that client or that patient doctor privilege. Number 3, and this is really important, members, If there are any complaints of any sort, on any subject regarding the abuse of a child, they are referred to the governing board for action. So I asked and I looked up what's the governing board for action. Well, Representative, the Minnesota Board of Marriage and Family Therapy is that governing board. And they were asked this question: how many corrective actions have been made regarding conversion therapy in Minnesota? Will Representative Cantrell yield to a question? Madam Speaker, will Representative Cantrell yield to a question?
He will yield. Representative Miller.
Thank you, Representative Cantrell. So as I said right before that if the Minnesota Board of Marriage and Family Therapy found that there was a problem of any sort of child abuse that gets reported, they investigate. And as you might imagine, they're the board that governs this, they govern it. So the question was asked, how many corrective actions have happened in Minnesota regarding what we're referring to as conversion therapy? Representative Cantrell, do you know how many there were?
Representative Cantrell.
Thank you, Madam Speaker. Representative Miller. Well, seeing as this is not illegal yet, I would love to hear how many corrective actions they've taken.
Representative Miller.
Representative Cantrell, the abuse of a child is illegal by a counselor, okay? And if there are any reports of child abuse of any sort, they're reported to this board. They are investigated, and if they find findings of this, and I can tell you that Dr. Bachman's clinics have been investigated on this. The answer is a real simple number to remember, members: 0. There's never been an action against this. So members, for the brevity of time, I know it was a long day yesterday, it's a long day today. I would encourage you to vote no on this. This is not something that is like something that happens in a room, in a dark room. There's no, I think people conjure images of shock therapy or Bibles being swung at someone saying, Satan away from you, Satan away from you, all these different things. Members, if you look online, if you go to Representative Cantrell's district, Representative Christian is back, and will Representative Christensen yield to a few questions?
She will yield. Representative Miller.
Representative Christensen, I knew you, at least I didn't see you sitting there before, so if you need a little bit of context, I'm more than happy to give that. But I would like to know if you have any clinics in your district that are currently performing conversion therapy.
Representative Christensen.
Thank you, Madam Speaker. Representative Miller, I don't have that information. No, I don't know.
Representative Miller. Members,
you,
if you could
Madam
please
Speaker.
use the side doors during the debate so that we could continue the debate and hear each other, that would be appreciated. Representative Miller.
Thank you, Madam Speaker. Well, Representative Christensen, you do. When I talked to, this is right, I don't know if you're in here, but when I talked to a young woman from out front Minnesota, came to my office to talk about this, I had asked the question, I said, where is this being performed in Minnesota? And she said 2 locations, and she said it was with counseling care owned. And I said, who owns that? And she said, Marcus Bachman. His wife is, of course, former Congresswoman Michelle Bachman. One of those is in Lake Elmo in your district. Have you, in preparation for the vote on this, have you talked with them or anyone else that's in counseling services?
Representative Christensen.
Thank you, Madam Speaker. Representative Miller. No, I haven't talked with them. And as you mentioned this, I did know. I'm sorry, I just stepped in, so I'm getting my head back into the floor here. I did realize, yeah, that there was that the Bachmans did have a therapy clinic in my district, but I have not spoken with them, no.
Representative Miller.
Thank you, Madam Speaker. And Representative Christensen, that's fine. I'm not trying to catch you off guard. I just want to know the information. Well, members, I won't go through all the questions again for the sake of brevity. But I will want to say that when we put labels on things like conversion therapy, there's an assumption that there's something that goes on that's different and above what's normally done. Conversion therapy, especially when you start attesting to child abuse and stuff like that, that sounds very scary, okay? And quite frankly, in today's culture, I think it's fair to say that when Christian is attached to it, Christian conversion therapy is sort of a harmful sort of thing, okay? I've talked with the one clinic in this district that has shown by any measure that they're doing this. And they explained a couple things. They explained what I mentioned there. They explained we just have children that come in that want to have therapy. They take them through. The woman from out front Minnesota said they just shouldn't be directing them to an actual final conclusion. Guess what? When I hear that it's client directed, that isn't happening, folks. But here's what is happening. If something like this gets signed into law, a complaint gets filed, and maybe 2 years later that complaint ends up being nothing. But what happens in the meantime? A business gets dragged through the mud. They go to court. They probably spend tens of thousands of dollars on attorney's fees. And guess what they do? They end up closing. They end up moving. They end up giving up. Members, I don't see in this a true interest in protecting children. I see this as an interest to go on the offensive against a group of people who are just trying to do what they're called to do, to serve their God. And I certainly hope that the members of this body are not going to stand behind that and go after one business that's in 2 districts. This is not something that's widespread, members. This is not something that's evil and creeping into the state of Minnesota. All the different innuendos that you're thinking about, that is not what's happening. You have a counseling service. My daughter, when she was a child, went to a counseling service that I thank God that they were there in Wilmer. Guess what? These are not going to be there in those communities. They're just going to go away. Members, I ask you to vote no for this. Thank you.
The member from Sibley, Representative Grunhagen.
Oh, thank you, Madam Chair. First thing I'd like to call for a roll call on the Cantrell amendment.
Are there 15 hands? I don't see 15 hands, Representative Grunhagen. There are not 15 hands. Representative Grunhagen, you may proceed.
Okay, thank you, Madam Chair. Just a couple things. I watched the full, and Representative Cantrell, I understand. I watched the entire testimony of the HHS policy. And just for the record, there were medical professionals that testified against this bill, also people of faith against this bill, and also former homosexuals and former transgenders who testified against this bill. So I understand none of us are for abusive, coercive testimony or conversion therapy, okay? None of us support that. I think we can address that separately. I think in many cases it has been addressed already. But I think this bill overreaches for a number of reasons. First, we do have a freedom of religion amendment. And in your amendment, this threatens churches and other organizations with prosecution for fraud if they offer fee-based services for helping young people or individuals who are struggling with their sexuality. I think that's contrary to the principles that our country was founded on. Secondly, members, I think we need to be compassionate on this issue. I just want to say a couple things about myself. When I came up here, was first elected, one of the first lobbyists, I think it was the first year, that I worked with to get one of my bills through the House and the Senate, and he was very helpful, was an active homosexual, okay? I won't share his name, but we got to be good friends. So I have friendships with current homosexuals and former homosexuals. I don't have any discrimination or bias towards them. Now we have disagreements, okay, on several principles, just like I do with some of my own caucus members and of course those across the aisle, but it doesn't have to affect the relationship necessarily. Secondly, I would just say that when I become acquainted with a couple of transgenders and a couple of former transgenders also. And one of the things I've noticed is that a lot of the people who go through the transgender process do so because they have some terrible problems or hurt in their life. And I think they come to the conclusion, for whatever reason, that trying to change their gender from male to female or female to male is going to help solve those problems. But when you talk to former transgenders, it does not solve their problems. In almost every case, the testimony is it's actually made them worse. Now, it's just not personal former transgenders that I've visited with, but also numerous articles that I've read and testimonies from former transgenders. And then, of course, we do have the brain development. To think that we can have a young child at 15, 16, or even 12 make this type of lifelong decision, which includes mutilating surgery and injection of dangerous hormones into their body, when their brain hasn't been fully developed to weigh the consequences, I think is a form of child abuse, members. The other thing, the psychological manual, DMS, still defines transgenderism, or young people struggling with their biology, or with their biological sex, as gender dysphoria. It's a mental health condition, according to psychology. So we need to help these people deal with that, help them realize that the problems they're having are not going to be solved by trying to move from one gender to the other, okay? That's the compassion I have. So both from a constitutional standpoint as well as from a personal standpoint, Representative Cantrell, please modify this amendment if it were to make it through and allow for young people who are in many cases confused and need our counseling and mental help in order to accept their biology, which overwhelmingly, I believe most experts would agree is what's best for them in the long run. Thank you, Madam Chair and members. Please vote to oppose this amendment. Thank you.
The member from Ramsey, Representative Fisher.
Thank you, Madam Speaker. I rise in support of the bill. The reason I support this bill is over the years I've worked with a lot of youth. Some of the youth that have come to us have been subject to this kind of therapy. And the most frustrating thing that I've found in my job is that when youth have come to us that we've been not able to help, and some of these youth that we've been working with have been subject to this kind of therapy where it's not client-centered, it's not client-directed. The youth in some of these instances end up being suicidal, and sometimes they end up in death. That is why the basis of this bill came from a bill I offered 4 years ago, and I ask people to please support it because this is something that still does happen from time to time.
Any further discussion? Representative New.
Thank you, Madam Speaker and members. This is a really tough amendment. We heard some really compelling testimony on this in committee. And for those of us who sat through committees, it was incredibly difficult. On both sides of this issue, frankly, there were some really compelling stories, and I think it is really important to recognize and honor the people who are supporting Representative Cantrell's amendment, because there are some people who have experienced really horrific things under the guise of conversion therapy. Things that absolutely should never be allowed in the state of Minnesota. But we also heard really compelling testimony on the other side of the issue from some folks who had a different plan for their own lives and wanted help and support in getting to where they wanted to be in their lives. We talked a lot about, and in fact, I spoke with Representative Cantrell and some different people on the issue, and I suspect I'm in the middle where nobody would be happy with my position on this. But if we kept this to exclusively banning this for kids, I'm there. We should not be messing around with children. But the scope of this bill goes much further than that. And it takes away agency and choice from adults who should get to choose how they're going to live their lives and the kind of support that they need for that. That day in committee was the hardest day I've had in the legislature. And I can't imagine anything eclipsing that for a long time. But until we can find a way to honor the experience of people on both sides of this issue, we need to wait. There are people who need a voice on both sides, and this bill doesn't do that. And so while I am so sympathetic to some of the really extreme and horrific experiences, this bill does too much. And I would recommend a no vote.
The member from St. Louis, Representative Sandstead.
Thank you, Madam Speaker. Representative New, you said this very, very well. And members, there is truth being spoken in this chamber today. Very difficult truth. Representative Cantrell, I cannot support this amendment because of the fact that it does not give the voice to the person to determine the outcome they choose. It does go too far. And on this one, we may have to agree to disagree. I do know that there is not a person in this chamber who supports the abuses and the atrocities that we heard. And I can stand assuredly and speak to that. There's nobody in this room who supports what we heard about. But it does go too far in taking away the right of an individual to determine the outcome they choose.
Representative Cantrell.
Thank you, Madam Speaker, members. This bill does not go too far. This bill is about protecting patients in Minnesota from fraudulent practices. And we do that all the time. We do not allow people to sell fraudulent products or fraudulent practices in our state, regardless of what age someone is. And I'm pretty disappointed, actually, in large part with the idea that, oh, you know, let's give the gay kids our sympathies. Let's give people struggling with sexual orientation and being condemned and potentially estranged from their families, let's give them our sympathies. They don't want our sympathies, they want our action. This bill is supported by medical professionals. This bill is supported by clergy. And I want to just kind of really quickly read off this letter that's included in your packets, page 9, if you want to follow along with me. We, the undersigned, strongly support the Mental Health Protections Act, also known as this House File 12. The act protects the mental health of LGBTQ adolescents and adults from sexual orientation change efforts, which research has demonstrated to be harmful and ineffective. Sexual orientation change efforts, also referred to as conversion therapy or reparative therapy, is usually defended by proponents because of their belief that same-sex romantic attraction is a mental illness and developmental disability to be cured. Scientific evidence, in contrast, has found same-sex attraction and gender nonconformity are healthy aspects of human diversity. Sexual orientation change practitioners base their treatments on unscientific and inaccurate understandings of sexual orientation, gender identity, and gender expression. This bill does not go too far. At least according to the American Academy of Pediatrics, the Minnesota chapter, the American Dance Therapy Association, Child Welfare League of America, Mental Health America, Mental Health and Developmental Disabilities, the state of Minnesota, Mental Health Minnesota, Minnesota Association of Community Mental Health Programs, Minnesota Disability Law Center, Minnesota School Social Workers Association, Minnesota Psychiatric Society, Minnesota Psychological Association, National Association of Mental Illness, or NAMI, and the National Association of Social Workers. And then also you'll see their healthcare professionals there undersigned. This bill does not go too far. If anything, this bill is long overdue, and we have a responsibility to all Minnesotans to make sure that they receive only the highest quality health care in the state of Minnesota. Members, I urge a yes vote. Thank you.
Representative Doubt.
Thank you, Madam Speaker. I'd request a roll call.
Representative Doubt requests a roll call. Seeing 15 hands, there will be a roll call. The clerk will take the roll. Clerk will close the roll. There being 72 ayes and 53 nays, the motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
New moves to amend House File Number 2414, the first engrossment as follows. The amendment is coded A145-1.
The member from Chisago, Representative New.
Thank you, Madam Speaker. I believe I have a series of amendments at the desk, and I'm wondering if I may take up the A143-1 amendment first.
So you would not like to withdraw your current amendment, but you would like to do the A143-1 first.
That is correct. Thank you, Madam Speaker.
Let me confer with the clerk. Representative New, the presiding officer determines the order of amendments. We're on the 145-1.
Thank you, Madam Speaker. Point of parliamentary inquiry.
State your point of parliamentary inquiry.
Thank you, Madam Speaker. If I withdraw an amendment, what is the procedure for bringing that amendment back?
Let me confer with the clerk. Representative New, I'm informed that the custom and usage of the body is that a member has spoken to and withdrawn an amendment, and then that amendment can be picked up by another member. But in the body, it hasn't been our custom and usage that a member reoffers an amendment that they themselves have withdrawn. Representative New.
Thank you, Madam Speaker. I move to withdraw the A145-1 amendment.
Representative New withdraws her amendment. There's an amendment at the desk. The clerk will report the amendment.
New moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A144-1.
Representative New temporarily withdraws the 144. There's an amendment at the desk. The clerk will report the amendment.
New moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A1431.
Representative New.
Thank you, Madam Speaker. There is a lot going on in this 1,100-page bill today. And I don't think it's any surprise that among the things that are most disappointing to us are the fact that we are raising the cost of health care with this bill. Not only are we cutting funding for our nursing homes, we're not finding the available money by finding solutions to fraud, but we're raising taxes in addition to that. And this provider tax is expensive. I've mentioned a couple of times, my late husband had ALS. And just to give you a little context, when you have ALS, you go to the doctor quarterly. So every 3 months, you go to the doctor. We have a couple of clinics in Minnesota that specialize in ALS, and they're wonderful clinics. They're these interdisciplinary clinics where you go, they put you in a room for the day, and all of your providers come to you. Respiratory therapists, neurologists, physical therapists, speech pathologists. You're there all day long, meeting with all of these different providers. But of course, with the provider tax, the sick tax, the cost of that day goes up 2%. And of course, when you're on disability, you're on Medicare, so it's our own, it's the tax dollars paying the tax dollars. It's a terrible system. The sick tax in this bill raises the cost of health care on every Minnesotan. Not only that, it makes being sick a taxable event. That is immoral. And so I'm hoping for just a little bit of relief with this sick tax. And so with my amendment 143-1, I'm hoping that we can at least exempt treatment for cancer. We all know everyone is affected by cancer. We all have loved ones who have experienced how devastating this can be and the roller coaster that it is. I suspect most of us have lost loved ones to cancer. And certainly while our loved ones are receiving these treatments for cancer, the least we can do is offer a little bit of relief through exempting this provider tax for this group of people. And members, I would recommend a yes vote.
Discussion to the amendment. Representative Carlson.
Madam Speaker, I'd like to raise a point of order under 4.03. After the adoption of a resolution by the Committee on Ways and Means, an amendment to a bill is out of order if it would cause any of the limits specified in the resolution to be exceeded. And there would be, as a result of this, a loss of revenue with the carve-out.
Representative New.
Thank you, Madam Speaker. Would Representative Carlson yield for a question?
He will yield. Representative New.
Thank you, Madam Speaker. I'm wondering what fund this creates an imbalance in.
Representative Carlson.
Well, Madam Speaker, it's a carve-out relative to the provider tax.
Representative New.
Madam Speaker, would Representative Carlson yield to another question?
Representative Carlson will yield. Representative New.
Thank you, Madam Speaker. I'm wondering if Representative Carlson can tell me what the target is for the Healthcare Access Fund.
Representative Carlson.
Madam Speaker, Representative New, I should have said the Healthcare Access Fund to your first question. We have a target number in the budget resolution. I don't happen to have the budget resolution with me, but I can certainly get you that number probably before we conclude the session here today.
Representative New.
Thank you, Madam Speaker. And if Representative Carlson would yield to another question.
He will. Representative New.
Thank you, Madam Speaker. I'm wondering, Representative Carlson, if you can also tell me how much this amendment would reduce the income in the Healthcare Access Fund.
Representative Carlson.
Madam Speaker, the issue isn't how much. The issue is that it would, and I think we should be addressing the question of the point of order 4.03. And the point is that there would be a loss of revenue. It doesn't make any difference relative to the interpretation of the rule as to what the exact amount would be.
Representative New.
Thank you, Madam Speaker. Well, it sounds to me like there's a lot we don't know. We're just guessing. There's no target, there's no fiscal note, there's no data. We're making a lot of assumptions here, and I would advise the point not well taken.
Representative Dowd.
If you could just give me a second to review the rule, I'd appreciate it.
I imagine we're both looking for the same words. They're not there.
Madam Speaker, advice?
Representative Dowd, please state your advice.
I don't think that this rule applies to the Healthcare Access Fund. I think it just applies to the general fund, but I would recommend that you would find this point of order not well taken.
Representative Carlson.
Madam Speaker, I indicated that I would get that number shortly. It's $357,769,000 is what the number is in the budget resolution. And I did check with the fiscal analyst, and they don't have the exact cost of the carve-out available, but there clearly is a cost. And so in interpreting the rule, as I said earlier, the question is that it does have a cost, and we don't have the exact number of the cost.
The maker of the motion argued that it would save somebody money, so I find the point of order well taken.
Madam Speaker.
The next.
I was standing up for advice while there was an interchange back and forth.
Representative Quam, under the rules, I don't have to take all the advice offered, just enough to make a decision. So we will return to the Representative New amendments. I believe Representative New would now like to offer the 144. But it doesn't matter, really. I don't care. There's an amendment at the desk. The clerk will report the amendment. Who wants to take ownership of the 144? The member from Chisago, Representative New, offers.
Moves to amend House File number 2414, the first engrossment as amended. The amendment is coded A1441.
Representative New.
Thank you, Madam Speaker. I've already spoken on the sick tax and how it raises the cost of health care, and we're trying to get a little relief for those who are in need of treatment for cancer. This amendment is very similar to the last one. It just changes the effective date to July 2021, which means that this should be in order. And I would ask for a yes vote, and I'd ask for a roll call, Madam Speaker.
Representative New requests a roll call. Seeing 15 hands, there will be a roll call. Representative Liebling.
Well, thank you, Madam Speaker. I mean, first of all, I'm very amused to hear the arguments of the minority here because, you know, removing the sunset doesn't raise anything. It just continues something that we've had in place here in the state of Minnesota for 25 years, maybe even longer than 25. So there is no tax being raised. There's just a continuation of something that's worked very well. And I think that at the beginning, Representative Loeffler spoke very well about the fact that if we don't support, if this provider tax was to sunset, that it in fact would raise the cost of health care in the state. We heard very clearly from the Hospital Association about the impacts to the rural hospitals. So I just want to put this in context, first of all. Secondly, I just wanted to say that I'm very sorry to hear about Representative New's husband. ALS is a dreadful disease. I know that we all really feel, you know, as human beings, we really hate to hear about things that do befall people. And this is something that moves all of us. And in fact, I right now have a relative in Florida who's going through the very same thing, and it's terrible. But I have to tell you, in Florida, they don't have the kinds of services that we have here in Minnesota. And my relative is in a lot worse shape than if they lived here, where we have the sorts of supports that we have for people that are going through these kinds of terrible situations, which can happen to anyone. And that is why we in Minnesota are so proud of the safety net that we have. Now, I want to turn to the particular amendment here, which attempts to carve out a certain condition and say, oh, we're not going to tax somebody who has this condition. Well, there are some real problems with this, members. One of them is that there is a reason it's called the provider tax. We don't tax the individual people. Yeah, we understand that it gets passed through. We do get that. But the thing is, the way the tax is collected, you have to think about that. If we're going to carve out particular people, particular conditions, what are you doing? You are creating an administrative nightmare for the providers who have to track this, and an administrative nightmare for the Department of Revenue that would have to have some way to confirm it. And by the way, and I don't know if Representative Scott is on the floor, she's usually a person who's interested in privacy issues. This would create a privacy nightmare, because how in the world would you be able to verify that the tax was missing from some patients and not from others, and why? So this is really very ill-conceived. But the other thing I want to say is that the date, the effective date, interestingly enough, assumes that the current provider tax goes forward. Because under current law with the sunset, there will be no provider tax collected after the end of this year, 2019. So I guess that the minority with these amendments is saying, yes, the provider tax will go forward, and for that I am very grateful. So good for you for recognizing that we need to keep this revenue stream in the state. You know, it would be really great if we could carve out some people and, you know, and do that, but the reality is that a lot of the providers don't like the tax for the very reason that the administration of it is really kind of complicated for them. I wish we had a way to straighten that out, but these amendments, this amendment and the others like it, all go in the wrong direction. So I'm going to ask members to vote no. I think you can feel very comfortable voting no, because if you vote yes, you will be voting to put more costs on patients and more costs on the system through a lot of administrative complication. And the other thing I want to mention, I think that Representative New said that her husband was on Medicare and this was collected. People who are paying through Medicare, Medicare is not charged the provider tax. Just want to make that very clear. So members, please vote no on this amendment.
Representative Quam.
Thank you, Madam Speaker. And I heard through the discussion from the chief author about, how we determine that this is an increase or isn't. This bill does increase the cost of health care. And I'm going back to multiple times there was testimony by the Department of Revenue and their expert witness, maybe even part of your caucus at this, staff at this time. And I had a bill that said we want to not tax equipment. Durable metal equipment requires every few months you need to replace a filter, etc. We had never taxed it because I was putting in a statute or trying to say we're not going to tax something that's required for life-saving equipment that isn't taxed. The Department of Revenue said, current statute doesn't eliminate us being able to tax it. Therefore, the fiscal note includes all the taxes we would be collecting from this because current statute didn't prevent us from doing it, even though we never have collected it. So the converse is, current statute says we are stopping the collection, stopping a 2% tax on our sick. And therefore, revenue, the consistent response from them, if we had them before us, would be a fiscal note. There would be an increase in revenue from current statute, which by definition, you are raising taxes, you're increasing the cost of health care, and I just wanted to correct the record from the previous statement.
Representative Bennett.
Thank you, Madam Speaker, and I would just like to echo a little bit of what Representative Quam just said, and I do take exception with saying that discontinuing the provider or continuing the provider tax, which is supposed to sunset, continuing that is somehow not raising people's taxes. Members, think for a minute about an example like this. Most of us pay a bank mortgage on our homes. Let's say you've been paying your mortgage for 25 years, and finally the year has come when your mortgage has matured and it's expiring at the end of this year. You've been making all of those payments, and you're looking forward to that extra money that you get to have when you don't have to make those payments anymore. It's a very similar thing. Obviously, people have been paying into this provider tax for years, 25 years is what I hear, or maybe more, and they're looking forward to not having to pay that anymore, and they shouldn't have to pay it. We can pay the funds that are needed, the expenses that are needed in different ways, but this is raising taxes, members. It's raising taxes on the worst thing, health care. As Representative New said, why should we be taxing the sick? They have burdens enough, members. This is increase in taxes. Let's be fair to the taxpayer, say it what it is, and then debate whether it should or should not continue. But let's make it clear, this is raising taxes on sick people.
Representative Davids.
Thank you, Madam Chair and members. The division chair, Liebling, said that she was amused. Well, I'm amused at her amusement because she made some comments that are absolutely false. And Representative Quam, Representative Bennett kind of hit it. The example is perfect, Representative Bennett. Let's say I was someone that had a mortgage. I read about people that had mortgages, but let's say somebody has a mortgage. Okay, they pay for the 25 years, just like you said, and then they are done. But now the banker comes and says, no, we just keep paying it. Really? Just keep paying it. So it is a tax increase. This bill cuts funding for nursing homes and allows rampant fraud to continue. So I'm amused at the division chair's amusement. This is a tax increase. This is a tax increase. And who signed the bill to get rid of this hideous sick tax, taxing the sickest of the sick? This is just so wrong. I give the example of where I come from in Fillmore County. You're out picking corn with a Minneapolis corn picker, two-row corn picker. It plugs up. Those things plug up all the time. John Deere's don't, Minneapolis Molines do. Okay, so it plugs up, you shut everything down, you put your hand in there, your arm in there to unplug it. It's off, everything's off. It recoils, your hand goes in, you lose your arm. So you go to the mothership in Rochester, the wonderful Mayo Clinic. They fix it. The bill is $300,000. Oh, by the way, you know another $6,000 because you lost your arm. Now, that's not Minnesota nice. This is a tax increase. Who signed the bill to let it expire? My good friend, Governor Dayton. And I applaud him for it. He could see that we should stop taxing the sickest of the sick. It's just wrong. This is not a provider tax. This is a sick tax. This is a cancer tax. This is a heart disease tax. This is a kidney transplant tax is what it is. So members, let's stop the rhetoric. And I'm amused by it because it's simply not true. I'm amused by someone that would stand up, a division chair would stand up and say that this isn't increasing a tax. Governor Dayton, in his wisdom, saw that this thing had to stop. 2011. Now, it wasn't way until 2019. Well, guess what, folks? 2019's here. So don't make false statements on the House floor. This is a tax increase.
Representative Bonner.
Thank you, Madam Chair. We have heard quite a bit of rhetoric on this particular issue. And for that reason, I've chosen to rise today to talk about something a little bit more personal. So some of you know that for about the first 3 years of my life, my parents were young. They were high school sweethearts, had me young. And so for those first 3 years, my grandmother practically raised me. My grandmother was a good, strong Christian woman. And I thank God literally every single day for her. She was a tremendous woman who faced incredible obstacles in her life through the loss of her husband, due to a tragic drowning incident that almost claimed the life of my father as well. And I often asked her how she survived that. And she told me that if it weren't for the grace of God and her church, she would not have done so. And while she would never admit that there was any deference to any of her grandchildren, I can tell you that the relationship I shared with her was one that was a little bit different. We were like two peas in a pod. And when I had difficulties at home and wasn't getting along with my parents, I called Grandma. When I needed encouragement, Grandma was there. When it was about a child who lived in a trailer for the first 3 years of her life and went on to go to college, I went on to college because it was my grandmother that pushed me to get educated, to go to school, to go to college, to be who I am today, and to do it with my faith in hand. And the unfortunate tragedy of that, her one dream in life was to see me graduate from college. And unfortunately, my grandmother didn't get to see that happen because she got cancer. She got cancer while I was away in college. And even while I was at college, she sent me letters continually to let me know how proud she was of my accomplishments. To be at a good Lutheran Swedish college at Gustavus. She was an incredible woman. And what I can tell you when we talk about this tax is that if my grandmother believed for 1 second that that 2% would help someone else with cancer to get treatment, my grandmother would have gladly laid down and said, absolutely, we should take care of our neighbors, we should take care of other people. And I believe that is what we read in the good book. And quite frankly, that is why we are here, to take care of each other, to take care of our neighbors. That's why we do the work we do here in the legislature. And for that reason, members, I would urge you to vote green.
Representative Johnson.
Pardon me, that was vote red on the amendment, excuse me.
Representative
Vote
Bonner.
yes for the provider tax.
Representative Johnson.
Members, I'm honored to support the Representative New's amendment.
It's a good thing because it helps reduce the cost of cancer care for our citizens of Minnesota. 2% on a cancer patient is a lot of money. And if the current bill that the division chair has is a tax increase, it's going to raise the cost of health care. It's not going to help lower health care costs. I talked to a couple individuals in my community that own small clinics. With this sick tax, they spend more money on accountants to figure out how much they owe than what they actually pay in the tax. So instead of charging 2% increase on the for the tax, they have to charge 5% to cover their costs to figure it out. That's absolutely ridiculous. I'm pushing for a green vote for Representative New's bill amendment because it's going to help lower some of the costs on some major, costly, horrific health issues. And I'm also hoping that this provision in this bill that's going to raise health care costs on all of Minnesota does not come through and the sick tax is ended permanently.
Representative Gruenhagen.
Oh, thank you, Madam Speaker. Yeah, just a couple things. One, even if we sunset the provider tax right now, it will not be completely defunded for 2 more years, okay? So we have 2 years to work on reforms, all right? And by the way, that's what we need to do for a number of reasons. You know, it's important to understand, like with Minnesota Care, that it reimburses at Medicaid rates. And that only covers about 20 to 30% of the cost of doctors and hospitals on average. Now, we've had Medicaid around for a long time, but we had a vibrant private health insurance market, and the baby boomers were primarily in the working force. With that combination, we were able to cost shift our losses on Medicaid and government health care onto the private market, which did drive the rates up in many cases to bail out the government programs. What has changed, though, is the world, members. We no longer have that vibrant market. And the baby boomers are leaving the workforce and retiring and drawing on government health care. So we have a chance to reform this system, to create a health care plan for our lower income people, and also that will reimburse doctors and hospitals, and I'm talking about able-bodied, not disabled, reimburse doctors and hospitals at a rate that will allow them to continue to provide excellent health care and access in our state. I would like to give you one example of a health care provider. A couple of months ago, I had to visit a oral surgeon right here in St. Paul for business. And I went in there, and when I talked to him, he informed me, we started talking about health care for some reason, I'm not sure why, but we did. He informed me that he was going to leave the state. And he also told me that he gave me permission to share his name in this story, but I'm not going to share his name. If you want it, you can see me later. But anyway, he told me, again, right here in St. Paul, he does oral surgery for decades, and he takes Medicaid patients from across the state. He's one of the few oral surgeons in the state that does that. So he provides access for low-income people. But he told me he's leaving the state, and he informed me 3 of his children have become medical professions. They've all left the state of Minnesota, okay? They don't want to practice here. And I said, well, you know, can you tell me why? He said there's too many taxes and too many regulations on our healthcare providers. He said, I'm leaving. So is that going to help access for our low-income people? When you chase out a oral surgeon who's been here for decades and take some of the lowest income people from all across the state, is that going to help access when you reimburse them at 20 to 30%? Members, we have 2 years to reform this system. The Healthcare Access Fund is still funded 2 years after the sunset. We can do this together on a bipartisan basis, take care of our low income, but create a system where we will actually reimburse providers in a way that we won't see less access, fewer hospitals, fewer doctors, but we will actually see more and build on the great healthcare system we have in the state. Thank you, Madam Speaker and members.
Representative Loeffler.
Thank you, Madam Speaker and members. I just want to correct I think a misunderstanding of what I expect will happen in the market if we allow the sunset on the provider tax to go forward. And that is, it will not reduce healthcare costs. In December of 2017, the federal government reduced the corporate tax rate on corporations 40%. And we have not seen since that large reductions in healthcare costs. I have not heard that any of that got passed on, reductions in the cost of drugs from Big Pharma. I have not seen or heard any printed reports on the reduction in medical device costs because of those large corporate tax reductions. We have had a real life experiment in what happens when big corporations get gigantic tax breaks, and I can tell you that those health corporations did not pass it on to their customers. I can't believe that a 2% adjustment will make any difference in the price that customers are charged 6 months from now. But I know it will make a difference if we keep this going, because if we lose $1.5 billion to $2 billion in a biennium out of our state budget, that's $2 billion because of the federal match. A lot of this is federally matched. That's a lot less money going to our health providers. It's a lot less money going to nurses. It's a lot less money going to home health care agencies. It's a lot less money spent in your local drugstore. It's a lot less money that patients have paying for their care. And that's, I think, the goal of all of us, is to make sure that we have a healthy state with people who can afford to be healthy and get the care that they need at a reasonable price when they're sick.
Further discussion to the Representative New.
Thank you, Madam Speaker. So as I thought about this, someone said that Representative Liebling, I suppose, was happy that I recognized the need for the provider tax. And I assure you I do not. You know, we have $1 billion budget surplus in our state right now. We do not need to raise taxes on the cost of health care. We do not need to raise the cost of health care. What I did, however, is I'm looking for the strike zone. And I didn't think that I would get away with actually getting rid of this repealer. I figured I was not going to get rid of the provider tax through an amendment today, but I thought that perhaps I could at least offer some relief for some groups that need it. And I wish I didn't need this amendment. I wish this provider tax was not coming back. I wish this tax was not being raised. It was mentioned that this isn't a tax on people, it's a tax on providers. But we all know what that means. Of course that's passed down to people. People are receiving the care. They are going to pay for it. That's how this works. It was also mentioned that this is a logistical nightmare. How could they possibly figure out how to tax some services and not tax other services? I don't know. I think if our grocery stores can figure that out, surely our healthcare providers can figure that out. It's just not that complex. Happens all the time. Members, I would encourage a green vote on this. Let's provide some relief for those who need it. People who are experiencing significant illness should not be taxed for being sick. Thank you.
Representative Liebling.
Madam Speaker and members, I just rise to remind the body that on your table, on your desk, is a letter, and it lists 162 organizations, including hospitals and all kinds of organizations that support removing the sunset on the provider tax. I also just want to correct something. When we talk about a mortgage, members know a mortgage is a loan that you got from the bank, and you're paying it off, and when you pay it off, you're done. And if they then say you got to keep paying, that's illegal. You've paid off your loan. That's not what this is. I would say this is, in a better analogy for this, is if I'm working at a job and I'm working along at that job, and one day I say, gee, I think I'll quit my job. Next month I'll quit my job. But when the end of that month comes, I say, I've changed my mind. I'm going to continue with my job. Did I get a raise? No. I'm just continuing with the salary that I had. That's what this is more akin to. This is not somebody paying off a mortgage. It just isn't. So I'm going to sit down and just urge members again to vote no on this amendment.
Seeing no further discussion on the amendment 144-1, the clerk will take the roll. The clerk will close the roll. With 53 yeas and 74 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk, and the clerk will report the amendment. I think we're doing.
New moves to amend House File Number 2414, the first and gross one as amended. The amendment is coded A148-1.
To the author of the amendment, Representative New.
Thank you, Madam Speaker. We just had a lengthy conversation about the sick tax and how this hurts Minnesota families. And so I'm going to try again. And I'm going to try to provide some relief this time for families experiencing the costs of pregnancy. I'm not sure if you're aware, but in Minnesota, the cost, actually specific to the Twin Cities, we have the third highest costs of having a baby by a traditional delivery among the 30 largest cities in the country. It is expensive to have a baby in Minnesota. The average cost of a vaginal birth in the Twin Cities is $11,527. That means the tax, just the tax, with this provider tax, with this sick tax, is $230.54. $230.54 to have a baby just in the sick tax. And heaven forbid you need a C-section. We're the fourth highest in the country for that, at a whopping $17,705, which makes the sick tax on having a cesarean section $354.10. I don't know how anyone argues that this is not raising the cost of health care. It is, by $354 to be precise. This is raising the cost of health care. Having babies, the cost of care related to pregnancy is extraordinarily expensive, and I hope that we can offer some relief through an exemption to the sick tax for these folks, and I would ask for a green vote.
Representative Liebling.
Well, thank you, Madam Speaker. And just to note that about half of the births in Minnesota are actually paid for by our medical assistance program or by Minnesota Care. So just to note that fact. And really the same arguments apply here, and I'm just going to ask members to vote no.
Representative Fabian.
Thank you, Madam Speaker. I just wanted to make sure we have a roll call on this. Thank you.
The roll call
I'd
has
ask for
been
a roll call.
requested. Seeing 15 hands, there will be a roll call. Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. Seeing 53 yeas and 75 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk, and the clerk will report the amendment.
Baker moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A153-1.
To the author of the amendment, Representative Baker.
Thank you, Madam Speaker. Members, this is in the same type of a vein of this conversation that we've had that Representative New has brought up, but I have a different approach to this, and I hope that members that have known me here over the last few years and few terms know that I believe I have some legitimacy behind my request to allow this sunset provision, which I had thought was going to end this year. But if it's not going to, and I don't know what it will look like when it leaves this body, but I'm asking that we look at substance abuse for opioids be part of the carve-out that I think we should allow that tax to be sunsetted for this purpose. And the reason I feel like I've got a different story, members, I actually came up with a new idea a couple years ago. And my good friend, Representative Olson, and I have been working this year on bringing some new revenue because I literally thought this was going to end this year. So knowing that we needed some funding and some more resources for opioids, my idea has been stirring around here the last couple of years about maybe it was a penny a pill, maybe it was this licensing reform that we did this year. And because this body did the right thing, we passed off a bill a few weeks ago, House File 400, that is now in conference committee, but we found new money. But that whole time I was literally coming down here thinking, but we can turn off the provider tax because we know that was supposed to sunset in a bipartisan fashion. So members, I want to see this carve out because back in 2011, when Governor Dayton then said, yep, we should be able to figure this thing out in 8 years, let's turn it off. He signed the bill that said, let's sunset this thing at the end of 2019. Well, that was the year I buried my son, Dan. And back in 2011, we had 200 people that died at the end of 2010. And so right at that moment was an important part of me deciding this is something that we need to do more of. So what's happened in the last 8 years? Well, we're at 422 deaths now because of opioids. So members, I'm asking you for a little political courage today, like I have brought to this body as a Republican asking for licensing reform. So I had my idea brought, and again, with all the work of so many members here, we had an idea to not take the sting out because I know that some more resources were needed. So that was one idea. That's one thing that we did. So why don't you join me in supporting this amendment, the A153, to say let's do this. At least I'm asking the chair, Liebling, to take this to conference, have this conversation as it moves along, because you know what? We did have another idea on this one. So I feel like I have the right to ask for this reasonable request. Members, Madam Speaker, I'd like to have a roll call on this if we could.
A roll call has been requested. Seeing 15 hands, there will be a roll call.
So members, for that reason, let's take this to conference. We have another bill that I feel very confident we're going to bring in some new resources. So I believe that my request is more than paid for from this issue because, doggone it, I'm sick and tired of having to fight this opioid epidemic that has doubled the deaths since our old Governor Dayton has had the strength then to say it was time to turn it off. So this is where the political courage and the backbones have to come in. This bill, this amendment is the right thing to put for this amendment on this bill. Thank you.
Representative Liebling.
Thank you, Madam Speaker. I would just, of course, I'm opposed to this amendment. I'm going to ask members to vote no on it. I just wanted to point out that 40% of people with opioid addiction use Medicaid to get their treatment. So if the provider tax goes away in Minnesota, we are putting at risk the treatment of at least 40% of the people with opioid addiction. So please vote no.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. With 53 yeas and 75 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk and the clerk will report the amendment.
New moves to amend House Law Number 2414, the first and gross one as amended, and the amendment is coded A156-1.
To the author of the amendment, Representative New.
Thank you, Madam Speaker, and thank you for the discussion. I'm going to try again. I'm going to try again with this sick tax here. We have now voted to continue taxing people with cancer. We have voted to continue taxing people in pregnancy. But I'm really hoping with this, you know, we've heard a ton about the cost of diabetes in the news in recent months and years. This is a big deal. And the cost of treatment for diabetes has gone up. And people are in crisis. And so with this amendment, I'm seeking to exempt the treatment of diabetes from the sick tax. There was some information shared earlier that this is a tax on providers, not individuals. But according to the tax incidence study from the Governor Walz's administration, it shows that the impact on families of the sick tax is $549 million. This is from the governor's administration. I'm not making these up. According to the Department of Revenue, the Minnesota Department of Revenue, our taxes are more regressive due to the sick tax. This is hurting lower income families more than it's hurting the wealthy. And with this amendment, I am seeking some relief for those who are burdened with the costs of caring for diabetes. And Madam Speaker, I would request a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Halverson.
Thank you, Madam Speaker, and I rise in opposition to this amendment. And I have to speak to this because I have type 1 diabetes. And I share that with people because I think it's important for folks to know that there's a lot of us walking around here, walking around in the world that have chronic illnesses and have diseases like type 1 diabetes. And it's important that everybody knows our faces. But this amendment will not help people with diabetes. We do have some really important comprehensive legislation that will help people with the cost of diabetes and diabetes treatment. This won't. This will actually put a lot of people at risk because we're going to put the Healthcare Access Fund at risk if we don't properly fund the Healthcare Access Fund, as we have done since 1992. And this policy was created in a broad bipartisan way. And so I say support security, support consistent care for all Minnesotans, and say no to this amendment. Thank you, Madam Chair.
Seeing no further Representative Pearson.
Madam Speaker, thank you very much for recognizing me, Madam Speaker. And I guess I want to rise because I just think it's important that everybody knows that I don't have type 1 diabetes. And then I think it's wrong that somebody who has type 2 diabetes has to pay 2% on top of their other care in order to pay for and fund the Healthcare Access Fund. I don't have cancer. I've never broken an arm. And I think it's wrong that the people who have cancer have to pay 2% on top of their bill. Maybe they're having a hard time even getting to work because they're going through their treatments, and we're going to add 2% to their bill. Never had a broken bone. I think it's wrong that we tax 2% for that care for somebody who goes through that. And maybe they're not able to get to work again. They're maybe not able to take care of their family and they have to ask other people for help. I think it's wrong. Earlier, my fellow Gusty stood up and spoke about how her grandmother would have been happy to pay the 2%. So would I. I just don't think I should have to get sick first. I think it's wrong to add 2% to the bill for everyone who's sick, everyone who's seeking dental care. Add 2% to their bill. One thing I don't quite get is if it's such a good idea at 2%, why aren't we doing it at a larger rate? How come the Democrats haven't come forward and said, let's fund the entire Health and Human Services bill on the backs of the shoulders of the people who are sick? What would that take? Would we have to bring the 2% up to 20%? If it's such a good idea at 2%, why don't we just fund the entire Health and Human Services budget that way? Adding 2% to the bill increases the cost of health care for every Minnesotan. And it's wrong. It's bad policy and it's wrong. You know, I also had to just stand up and correct the analogy again of the chair of the Division of Health and Human Services. She brought up the fact that it was a job that this fund was doing. The distinction is the federal government came in and did that job. So it'd be like asking to be continued to get paid after the federal government came in, someone else came in and did your job. Now, the Healthcare Access Fund does a lot of good things, but the setup of the 2% provider tax was done 26 years ago to cover for healthcare costs that are now primarily carried by the federal government. The job has been taken and you're still asking to get paid. It's increasing the costs of health care. It's wrong. We should vote in favor of the amendment.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. Franzen votes aye. Doubt votes aye. With 53 yeas and 75 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk and the clerk will report the amendment.
Franzen moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A100.
The member from Douglas, Representative Franzen.
Thank you, Madam Speaker and members. So not only does this bill raise the cost of health care, and not only does it cut nursing homes,
funding for our nursing homes. But this bill also allows for rampant fraud to continue in the child care assistance program. And so I am offering some amendments to address what I find is lacking in this 12-pound bill. The amendment that I'm offering right now requires county or state licensors to immediately report any suspected fraud to the appropriate authorities. I think that's important, members. If there is a licensor that is visiting a facility and they suspect fraud, they should turn it in. Licensors who perform on-site inspections are in a good position to not only see signs of potential fraud, but have the experience, folks, to know what to look for. If a licensor sees something that doesn't look right, they should be sharing those concerns with investigators to follow up. If you see something, licensor, say something. That's what this amendment does. And Madam Speaker, I would also like a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Representative Franson, there is an amendment to the amendment at the desk. The clerk will report the amendment.
Franson is moving to amend her amendment to House File 2414, the first engrossment as amended. The amendment to the amendment is coded A196.
Representative Franson, to your amendment to the amendment.
Thank you, Madam Speaker and members. I would also like a roll call on this as well. Thank you.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Franson.
Okay, so this amendment to the amendment clarifies that the appropriate authorities are either the county or state fraud investigators. They do amazing work all around the state. Some of our county fraud investigators have testified in front of the committee that I used to chair and have come and testified in front of Representative Pinto's committee. And we are also providing immunity to a licensor who makes good faith report as required by the law. It is not uncommon for good faith protections for reporting suspected child maltreatment. Thank you, members.
Discussion. Representative Pinto.
Thank you, Madam Speaker, and thank you, Representative Franson, for bringing these forward. So, members, the next set of amendments we're going to be considering relate to child care assistance, some other public programs and concerns raised. And so, with your indulgence, members, I'm going to take just a couple extra minutes right now because I think it's going to make things a lot easier on some of the future amendments, because Representative Franson referenced what is lacking in the bill in responding to concerns about integrity of programs. And members, I think you'll find that if you look at the bill, you'll find that there is a tremendous amount that is in this bill that addresses this concern. I think we first need to mention and note that the people who are most hurt by any misuse of funds are, of course, the kids and families that depend on the program. And integrity in the program does mean that those kids and families get the support that they need, with providers getting a fair rate. And the bill does address those issues, but it also takes strong action to ensure the integrity of the program regarding misuse of funds and holding those accountable who are doing that. I'm a prosecutor. My work outside the legislature. Any misuse of public funds, any wrongdoing concerns me greatly. And again, I take action against that outside the legislature. So what does the bill do, members? I want to not be brought up later on for repeating things, so I'm going to lay it out right now. It improves identification, strengthens the investigation response process, increases consequences, increases transparency, and perhaps most importantly, prevents wrongdoing in the first place. Okay? Now again, let's walk through those. What does it do to improve identification? Again, I beg your indulgence here. There are staff added to develop an electronic attendance and billing system. This was identified as a particular concern. If you've got paper records, it makes it a lot harder to make sure that everything is going the way that it should. We need that. It strengthens record-keeping requirements by providers and improves documentation by vendors. It increases referrals for fraud investigations via 8 licensing staff, with that being a major part of their work. It increases data analytics. This is a point that was raised in our legislative auditor's reports, via several analysts who are being added to do that work. It provides immunity for good faith reporters of healthcare fraud. I'm going to get to that in this amendment in just a second. We already have that for child care assistance reports, but it adds that as well. So more identification. Topic area number 2 of 5, we strengthen investigation and response process, allowing disclosure of program information to investigators, providing access to records, 4 more investigators for fraud in the medical assistance program, 2 more law enforcement investigators at our Bureau of Criminal Apprehension, grants for counties to prevent and investigate fraud, a new administrative disqualification process for wrongdoing, and a lowering of the standard of proof in that to make sure that providers who are misusing funds can be held accountable. A better case tracking system, this was identified in the report. A new crime of soliciting a kickback or offering a kickback in regard to this. Representative O'Neill had offered some important improvements to that. That's included as well. That's area number 2. Number 3, increasing the consequences and preventing further wrongdoing. We're increasing sanctions for vendors of health services who commit fraud, including forfeiting payments, immediately suspending somebody's license if they're criminally charged. Extending the disqualification time for the first offense, disqualifying somebody who's been found to be wrongdoing in one program to go to others as well, and creating a list of excluded healthcare entities and requiring vendors to review that list before they work with them. Area number 4 is prevention, warning participants of fraud and the consequences with them having to acknowledge that understanding, providing technical assistance and training on proper billing and record keeping, and making sure, by the way, that that is linguistically and culturally accessible, providing technical assistance to new programs especially, making sure that they're on the straight and narrow, doing things right, and finally increasing transparency, disclosing payments so people can see from the outside what is going on in the program. Members, I would say that Representative Franson mentioned addressing what is lacking. Boy, there's a lot in there, and I could have taken a lot more detail, and I guess I may need to in response to amendments. So members, regarding the A196 amendment, which is before us, members, the second part of that provides good faith immunity for somebody who makes a good faith report, That is already the law, section 245E.08. Please look it up. It relates specifically to child care assistance. And the first part of this provides that rather than a referral to the appropriate authorities, it's to county or state fraud investigators. My concern is that's too narrow. We want to make sure that if you've got somebody who's a lower level person in the department, they can make the referral to their boss, who's going to be obligated to make the referral on as well. I think appropriate authorities actually gives us a nice sense of what should happen. And so, members, I would ask that the 196 amendment be voted down, and we'll get to talk about some of these other areas, I'm sure, as well. Thank you.
Seeing no further discussion, the clerk will take the roll on the amendment to the amendment. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The amendment is not adopted. To the underlying amendment, Representative Franson. No. Any further discussion? Representative Pinto.
Thank you, Madam Speaker. I have some concerns with the A100, in part wondering if we want to actually have a broader set of people who are obligated to report. But in any case, we certainly want to have licensors be immediately reporting suspected fraud. And so, members, I would urge a green vote on the A100. Thank you, Madam Speaker.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 129 ayes and 0 nays, the motion prevails and the amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Franson moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A109.
Representative Franson, to your amendment.
Thank you, Madam Speaker and members. The A109, another exciting amendment to address what I find is lacking in addressing the fraud in the Child Care Assistance Program. This amendment provides for the temporary, immediate suspension of a license if a child care license holder fails to comply with the child care fraud investigation requirements. So, members, I think it is very wise of us to say to the taxpayers that we are taking this issue very seriously, because taxpayers know that we here have a problem with fraud. There is rampant fraud that is continuing in this program. Section 245A 07, subdivision 3, provides for the immediate temporary suspension of a license under certain conditions, as found on page 88 of the bill. I know there's over 1,000 pages, 1,100 pages of this 12-pound bill. Page 88 isn't too hard to find. Chapter 245E is the chapter that governs Child Care Assistance Program fraud investigations. If a child care provider fails to comply with a fraud investigation, the other requirements under Chapter 245E, then there should be swift and severe action. And Madam Speaker, I would also like to request a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Discussion, Representative Pinto.
Thank you, Madam Speaker. So again, regarding there being something that's lacking, the law, so this is unneeded. The law actually already allows the department to stop child care assistance payments to providers who are refusing to cooperate, et cetera. It's in Minnesota Statutes 245E.03. Also, there's a big concern here that this would actually jeopardize fraud investigations, because what it would do is make investigative data public, in fact, which is, and I certainly would know this in working with the law enforcement that I do, we do not want to do that. The reason that this would happen is because with an appeal to the Office of Administrative Hearings, which would be allowed under this, the data would then be public. And I'll note that the temporary immediate suspension could then expire before the investigation is over. In any case, unneeded, problematic. Vote it down. Thank you.
Any further discussion? Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The amendment is not adopted.